Kidney disease doesn't appear all at once. It unfolds gradually, stage by stage, often without clear warning signs. And in this video, we'll walk through stages 1 to 5, explaining what's happening inside the body, why symptoms emerge when they do, and how progression actually works beyond lab numbers. So let's start from the stage 1 kidney damage with normal filtration. This is known as the beginning of kidney failure. They work normally and can't be diagnosed easily. The danger here isn't pain or weakness, it's silence. What's happening is small, quiet, and easy to ignore, which is exactly why progression often starts here without resistance. Well, let's see what diseases you feel at this stage. Diabetic nephropathy, early stage. Imagine a disease that starts changing your kidneys long before blood sugar feels out of control. In early diabetic nephropathy, high glucose levels damage tiny blood vessels inside the glomeruli, weakening their filtering walls. This allows microscopic amounts of albumin to slip into urine, something you can't see or feel at first. Kidney filtration rates may still look normal, which creates false reassurance. Internally, though, pressure inside these filters rises, accelerating wear. This stage doesn't cause pain, swelling, or fatigue, so most people remain unaware. Without early intervention, better glucose control, blood pressure management, and medication, the damage compounds quietly. Diabetic nephropathy doesn't suddenly appear in later stages. It grows slowly, laying its foundation here, often years before symptoms force attention. Hypertensive nephrosclerosis, early stage. What if constant pressure was slowly crushing your kidneys from the inside? Early hypertensive nephrosclerosis works exactly like that. Long-standing high blood pressure damages the small arteries feeding kidney tissue, narrowing them over time. As blood flow becomes restricted, parts of the kidney receive less oxygen, leading to gradual scarring. Filtration can still appear normal, which is why this condition hides so well. There's usually no pain, no swelling, and no warning signs early on. The damage accumulates silently, stiffening vessels and reducing the kidney's ability to regulate pressure properly. Left unchecked, this creates a feedback loop. Higher pressure causes more damage, and damaged kidneys worsen blood pressure. Stage 1 is where this cycle quietly begins. Glomerulonephritis, early inflammatory forms. Inflammation that doesn't burn or swell, but quietly disrupts filtration. Early glomerulonephritis involves immune-driven inflammation targeting the glomeruli, the kidney's filtering units. This inflammation alters membrane permeability, allowing protein or blood cells to leak into urine, often detected only on lab testing. Kidney function may still register as normal, masking the problem. Some people notice darker urine or mild swelling, but many feel nothing at all. The immune system continues its low-grade attack, gradually damaging filtration surfaces. Without treatment, inflammation leads to scarring, shrinking functional kidney tissue over time. Stage 1 glomerulonephritis isn't dramatic, but it's decisive. What happens here determines whether damage stabilizes or advances. Polycystic kidney disease, early structural damage. Think of kidneys forming tiny cysts long before they interfere with function. In early polycystic kidney disease, fluid-filled cysts begin developing within kidney tissue, slowly distorting normal structure. Despite this, filtration often remains normal for years, which delays diagnosis. The kidneys quietly enlarge as cysts multiply, compressing surrounding tissue and blood vessels. Most people at this stage feel completely fine, though some notice vague flank discomfort or high blood pressure. The real issue is architectural. Healthy tissue is being displaced bit by bit. Stage 1 is deceptive because damage is structural, not functional yet. But once space is lost, it can't be reclaimed. Reflux nephropathy, early scarring. What you don't expect to harm the kidneys often does in reflux nephropathy. This condition begins when urine flows backward from the bladder into the kidneys, usually due to valve defects or childhood infections. Repeated backflow exposes kidney tissue to pressure and bacteria, leading to localized scarring. Early on, kidney function appears normal, and symptoms may be absent entirely. The scars form silently, reducing the number of working filtration units. Blood pressure may rise subtly as damaged areas disrupt normal regulation. Many adults discover this condition incidentally, unaware that the damage began years earlier. Stage 1 reflux nephropathy isn't loud, but its scars permanently alter kidney resilience. And now we are moving to the Stage 2 kidney disease, mild loss of function. At this point, kidneys are no longer working at full strength, even if life still feels normal. Filtration begins to dip, damage becomes consistent rather than occasional, and lab results stop, bouncing back. This stage is where quite problems start leaving fingerprints: persistent proteinuria, albuminuria. All right, this is where leakage stops being a fluke and starts becoming a pattern. Persistent proteinuria means albumin continues escaping into urine over time, confirming ongoing damage to the glomerular filter. The kidneys are still functioning, but their selectivity is compromised. This loss reduces albumin levels in the blood, subtly altering fluid balance long before visible swelling appears. Many people feel fine, which is why repeated urine tests matter here. The persistence, not the amount, is the warning sign. Left unaddressed, constant protein loss accelerates scarring inside the kidneys, pushing disease forward even when filtration numbers don't look alarming yet. Early chronic interstitial nephritis. Early chronic interstitial nephritis affects the spaces between kidney tubules, often triggered by long-term medication use, toxins, or autoimmune activity. Inflammation develops gradually, interfering with salt handling and urine concentration. Filtration decline is mild but measurable. People may notice increased urination or subtle electrolyte shifts, though many remain asymptomatic. The danger lies in persistence. Ongoing inflammation slowly replaces healthy tissue with fibrosis. By the time symptoms appear, structural loss has already occurred. Stage 2 is where stopping exposure can still change the outcome. Worsening diabetic kidney disease. What started quietly in Stage 1 now becomes harder to ignore on labs. Worsening diabetic kidney disease shows rising albumin levels and a gradual decline in filtration. High glucose continues to damage glomerular vessels, thickening membranes, and increasing internal pressure. The kidneys compensate less effectively, and protective mechanisms begin failing. Blood pressure often creeps upward, further stressing filtration units. Symptoms still lag behind damage, which tricks many into thinking control is adequate. This stage is critical. Tight glucose and pressure management here can dramatically slow progression, while neglect almost guarantees advancement. Salt-sensitive hypertension. Here's where kidneys start reacting poorly to something most diets overload. Salt-sensitive hypertension develops when damaged kidneys struggle to excrete sodium efficiently. Even moderate salt intake leads to fluid retention and rising blood pressure. This pressure feeds back into kidney damage, stiffening vessels, and worsening filtration loss. Unlike typical hypertension, small dietary changes can cause noticeable pressure swings. Many people blame stress or genetics, missing the kidney connection entirely. Stage 2 is where blood pressure stops being just a cause and becomes a consequence, locking kidneys into a damaging loop. Alright, we hope you learned this very well. Now let's talk about Stage 3 kidney disease. Moderate kidney disease, symptoms begin. This is the stage where kidney disease stops being abstract. Filtration loss becomes meaningful, compensation weakens, and the body starts reacting in ways people can no longer ignore. Stage 3 is where confusion often turns into concern. Chronic kidney disease, mineral and bone disorder, CKD-MBD. In this one, your bones are slowly losing their stability because your kidneys can't keep minerals in balance anymore. CKD-MBD begins when failing kidneys stop regulating phosphate and calcium properly. Phosphate accumulates in the blood, calcium levels drop, and vitamin D activation declines. These shifts disrupt bone remodeling, making bones weaker even before fractures occur. People don't feel this process happening. It unfolds quietly in the background. Blood tests may show rising phosphate long before X-rays reveal damage. This disorder doesn't stay limited to bones either. Excess minerals begin affecting blood vessels. Stage 3 is where this imbalance becomes established rather than occasional. Secondary hyperparathyroidism. Your body tried to fix low calcium by slowly dismantling your skeleton. That's what secondary hyperparathyroidism does. As calcium levels fall, parathyroid hormone rises to compensate, pulling calcium out of bones and into the bloodstream. Initially helpful, this response becomes destructive when sustained. Bones weaken, joints ache, and fracture risk climbs. The kidneys can't correct the imbalance anymore, so hormone levels stay chronically elevated. Many patients feel vague bone pain or muscle weakness without knowing why. Stage 3 is where this hormonal loop becomes locked in. Renal anemia, low erythropoietin, feeling exhaustion that sleep doesn't fix. In stage 3, kidneys begin producing less erythropoietin, the hormone that signals bone marrow to make red blood cells. As levels fall, anemia develops gradually. Oxygen delivery drops, making everyday activities feel heavier than they should. Climbing stairs becomes tiring, focus fades, and stamina shrinks. This fatigue often gets blamed on age or stress, delaying diagnosis. Renal anemia isn't caused by iron deficiency alone, it's a signaling failure. Stage 3 is where this shortage becomes clinically significant. Uremia, early toxin buildup. Early uremia begins when the kidneys can't clear metabolic toxins efficiently. These substances circulate in the blood, subtly affecting nerves, skin, and sleep. Itching may appear, concentration may dull, and appetite may start fading. Symptoms fluctuate, which makes them easy to dismiss. The buildup isn't dramatic yet, but it's persistent. Stage 3 marks the shift from effective clearance to accumulation, setting the stage for broader systemic effects. Metabolic acidosis. When the kidneys lose the ability to balance acid, the blood slowly becomes more acidic. Metabolic acidosis develops as hydrogen ions accumulate and buffering systems weaken. Muscles break down faster, bones release minerals, and breathing patterns subtly change to compensate. People may feel fatigue or muscle weakness without an obvious cause. The body works hard to adapt, but compensation has limits. Stage 3 is where acid balance stops being stable and starts drifting in the wrong direction. Well, now let's move on. Stage 4, kidney disease, severe kidney disease. At this stage, kidney failure is no longer approaching. It's actively reshaping the body. Filtration is severely reduced. Toxins accumulate faster than compensation can manage, and multiple systems begin failing together. This is where preparation turns into necessity. Advanced uremic syndrome. Advanced uremic syndrome develops when toxins build up to levels the body can't buffer anymore. These substances affect nearly every system, from the brain to the skin. Concentration fades, nausea becomes frequent, appetite collapses, and itching turns relentless. Sleep is disrupted, energy is drained, and mental clarity dulls. This isn't caused by one toxin, but a mixture circulates continuously. The kidneys can no longer clear them efficiently, and symptoms stop fluctuating. They persist. Stage 4 is where uremia becomes a dominant force rather than a background issue. Severe anemia of chronic kidney disease. In stage 4, erythropoietin production drops sharply, starving the bone marrow of signals to produce red blood cells. Oxygen delivery falls, leaving muscles weak and the heart working harder. Even short walks feel exhausting, dizziness appears, and shortness of breath becomes common. Iron may still be present, but without hormonal signaling, it can't be used effectively. This anemia is profound, progressive, and no longer subtle. Without treatment, it accelerates heart strain and worsens overall decline, vascular calcification. Here's where minerals start hardening and what should stay flexible. Excess phosphate and calcium deposit into blood vessel walls, transforming smooth, elastic arteries into rigid structures. These vessels lose their ability to adapt to blood flow and pressure changes. Circulation becomes inefficient, raising cardiovascular risk dramatically. In some cases, hardened arteries can even be felt beneath the skin. This process doesn't happen overnight. It's the result of prolonged imbalance finally taking control. Stage 4 is where vascular calcification becomes widespread and dangerous. Renal osteodystrophy. Renal osteodystrophy develops as calcium loss, phosphate retention, and high parathyroid hormone combine to weaken bone structure. Bones lose density, flexibility, and strength. Fractures occur more easily, sometimes from minor falls or normal movement. Height loss may become noticeable as spinal compression increases. Pain may appear in the back, hips, or joints. This isn't simple osteoporosis, it's a systemic bone disorder driven by kidney failure. Stage 4 marks irreversible skeletal involvement. Restless leg syndrome, uremic driven. Night brings no rest when nerves won't stay still. Uremic-driven restless leg syndrome arises as toxins trigger inflammation and disrupt iron availability in the brain. Dopamine production suffers, creating an irresistible urge to move the legs, especially when lying still. Sleep becomes fragmented, deep rest disappears, and fatigue compounds. This condition isn't psychological, it's biochemical. As kidney function worsens, symptoms intensify. Stage 4 is where restless legs shift from annoyance to nightly torment. And now it's the time for the last, Stage 5, kidney disease, end-stage renal disease, ESRD. And this is the final stage where the kidneys can no longer support life on their own. Filtration capacity collapses, toxins overwhelm every system, and the body loses its ability to self-correct. Dialysis or transplant is no longer optional, it becomes survival. End-stage renal disease, ESRD. What you're looking at here isn't a single symptom, it's total loss of kidney independence. In ESRD, the kidneys can no longer remove waste, regulate fluids, balance electrolytes, or support hormone production. Toxins accumulate continuously, fluid overload becomes dangerous, and blood chemistry drifts out of safe range. Urine output may drop dramatically or stop altogether. Without dialysis or transplant, toxins rise to fatal levels. This stage doesn't arrive suddenly, it's the result of years of progressive damage. At this point, treatment shifts from preservation to replacement. The kidneys are no longer failing, they have failed. Uremic pericarditis. Uremic pericarditis occurs when accumulated toxins irritate the pericardium, the thin sac encasing the heart. Each heartbeat causes inflamed layers to rub together, producing sharp chest pain that worsens when lying flat. Unlike muscle pain, rest offers no relief because the heart never stops moving. Fluid may also collect around the heart, impairing its ability to pump effectively. This condition signals advanced toxicity and requires urgent intervention. In stage 5, uremic inflammation no longer stays confined, it reaches vital organs. Uremic encephalopathy. Uremic encephalopathy develops when waste products cross into the brain, disrupting nerve signaling. Early signs include confusion, difficulty concentrating, personality changes, and slowed reactions. As levels rise, symptoms progress to tremors, seizures, and decreased consciousness. This isn't mental illness, it's chemical interference. The brain simply can't function in a toxic environment. Stage 5 is where neurological symptoms reflect systemic poisoning, not fatigue or stress. Multi-organ failure without renal replacement therapy. Here's the hard truth. Without dialysis or transplant, kidney failure doesn't stay isolated. Heart, lungs, brain, and immune system begin shutting down under toxic stress. Blood pressure destabilizes, oxygen delivery falters, and infections overwhelm defenses. This is why stage 5 is incompatible with life without intervention. The kidneys were holding far more together than most people ever realized. So, we hope you learn these diseases well, and if you feel any one of the symptoms, don't sit. Relax, contact your doctors immediately, and if you like the video, then don't forget to press the like and subscribe button, which encourages us to make more videos like this for you. Thanks for watching and spending time with us.